Hello, my name is Carol Brown. I'm an Excelsior College student nurse. I will be giving insulin today. First thing I'm going to do is actually pull out the MAR. And the MAR says the patient is Millie Larson, date of birth 1/1/1936. She has no known drug allergies. The doctor ordered Lispro 10 units per sub-Q. Okay, I'm going to do hand hygiene. Then I'm going to gather my supplies. I have some gloves and insulin syringe. We've got the medication, which is insulin Lispro, 100 units per milliliter. The expiration date is 4/2031. I've got alcohol pads. I'm going to go ahead and, well, I also have a Sharps container. Go ahead and use the alcohol wipe to clean the top of the insulin container. Take out my insulin syringe. Take the top off. Go ahead and put 10 units of air in. I'm going to draw up 10 units of insulin. And then with one hand, cap it, but very carefully. So I've got my insulin, got everything I need. Before I go, I'm going to check one more time, make sure I have everything correct. Millie Larson. It's the Lispro 10 units sub-Q, and it's to be given now before or with breakfast. So she's about to go to breakfast. And I did check to make sure it's the correct insulin. And we have 10 units, which says 10 units on the chart. I'm going to bring in all my stuff, set of gloves, the insulin, alcohol, syringe, or the Sharps container, and alcohol swabs, or alcohol wipes. And I'll bring them all with me. Good morning, Millie. My name is Carol Brown. I'm an Excelsior College student nurse. I'm here to give you insulin. The doctor ordered 10 units of insulin sub-Q before, or actually during your breakfast. So you're going down to breakfast, so I'll give you some insulin to keep your blood sugars down. And what is your full name? Millie Larson. Okay. And your date of birth? 1/1/1936. And I'm going to check your arm band. Millie Larson, 1/1/1936. Perfect. So I'm going to go ahead and do a little hand hygiene again right before I give this to her. Make sure I rub it in really good and it dries. Go ahead and put my gloves on. We're going to give you the insulin in your abdomen today. So make sure she's covered nicely. Just show the abdomen. Got my insulin. And we're going to use this little device to give the insulin in, so I'm not putting it in here. But you would look before 2 inches away from the umbilicus. Make sure there's no bruising, redness, raw areas. You would take your wipe, rub the area in circular motion going out. I'm going to leave that alcohol wipe right there so I can see it. Then I'm going to take off the top. I'm going to take the skin with my non-dominant hand, kind of pinch it a little bit. And then I'm going to 90 degrees push the needle in, and then push the insulin in, pull it out directly. Then this is a safety syringe, so I just push it up so now it's safe. And I'm going to put it directly in the Sharps container, which is right here. And I can wipe this area down a little bit. I'm going to cover Millie up over the bed, hand her the call light. If you need any assistance to go downstairs, let me know. I will either be me or someone else. Bring your call light if you need me. Then I'm going to throw everything away. Take off my gloves. Throw everything in the trash. Use hand hygiene. Then I'm going to go out, make sure I document that I gave her the insulin. So I'm going to initial. There we go. All right. Thank you very much.